Hello, I'm Dr. Jessica McCain with Southern Comfort Marijuana Clinic. I'm board certified in family medicine and have been involved in medical cannabis since the passing of Florida's Amendment 2 in 2016. These educational videos are designed to help guide patients in the process of legally accessing and using cannabis specifically for disease treatment and health promotion. You may have already seen our other videos, including one about the legal process of becoming a medical marijuana patient in Florida, and another titled Marijuana as Medicine, which is a review about the science behind the herb. In this video, we go over a few strategies for starting your cannabis treatment. I'd like to explain that there is no simple prescription that will work for each condition, and the bottom line is that cannabis use is very individualized for each person, so it can take time trying a variety of products before the final goal is met. Even for those experienced in cannabis use, I can offer suggestions to complement your existing routines for additional health promotion benefits and financial savings. I need to emphasize that our focus at SoCo is completely medical, so we cannot support recreational use in this setting or the resale of products. We started using videos to explain cannabis products and treatment strategy because often the initial experience is overwhelming and there is a time delay before you can make your first purchase. So despite our in-office education, patients still felt unprepared sometimes. We found that by supplementing with videos, patients could watch and take notes at their own pace and could reference back if needed. The result has been greater success rate for our patients and less additional consult visits needed. We will give you this medical marijuana recommendation sheet as a guide that highlights many of the discussion points in this video. Three main categories taught are method of use, the choice of product, and the amount to consume. It would be very helpful if you had previously watched the video titled Marijuana as Medicine for a review of the actual science of cannabis and terminology so you can better follow along. We'd like you to keep track of your results in a journal. This will help you select the dispensary and products you prefer and avoid tolerance that comes with less benefit and increased cost. Every dispensary has quality products, but are very different based on their business models and theory of cannabis as medicine. Part of your selection is science and other preference. Unfortunately, the terminology in Florida is not standardized, so this requires you to be a smart shopper. Pricing and sales can fluctuate frequently, and we do not keep up with that information. Keep in mind that the salespeople have variable levels of training, likely minimal clinical experience, but probably a passion for marijuana in general or a motive to push one product over another. Do not feel obligated to stay with one dispensary, especially if they've run out of stock on your ratio or stopped carrying the strain that worked previously for you. Here are some questions to ask the dispensaries, which are also called medical marijuana treatment centers. But also talk to other patients. Word of mouth is often a great source of information. First, can they see if your RD card has been approved? What are the credentials and experience levels of the wellness coordinators? Each dispensary does have a pharmacist on staff. What types of products do they carry? Do they specialize in any specific strains, and what makes them special? How do they label the CBD-THC ratios? For example, which one is written first? Or do they write it as a percentage of CBD and THC in comparison to the total cannabinoid makeup? You may even consider asking to see their lab reports, which verifies consistency in products on repeat testing, contaminants like pesticides or molds, and etc. Is this an independent lab test? Is their CBD coming from hemp? If you have any food sensitivities or allergies, make sure to ask if they have any additives in their products, or do they use the same processing facilities that may use nuts, safflower oils, fruit extracts, or alcohol in the processing stages. What is the average cost per gram of the herbal cannabis? What are their delivery fees? Some are actually free. Promotional discounts. Do they reimburse you for the cost of the ID cards or any other type of appreciation discounts like epilepsy of the month discount, new storefront deals, and etc.? We do want to remind you that every dose will affect the body, so set realistic expectations and use responsibly. The doctor will review your medication and note if there are any additional warnings to heed. In general, at reasonable and consistent doses, the risk of drug interactions are rare. With oral ingested routes, the need for the liver to compete with pharmaceuticals and cannabis metabolism may affect the effectiveness of prescription dosing. Be mindful, your anticipations will magnify any conflicted feelings about cannabis use, so use it when you're in a pleasant and non-rushed atmosphere. Overdose will not cause long-term organ damage or death, but can lead to an uncomfortable experience for 4 to 24 hours. And remember, scientists tried to find a lethal dose, and with thousands of milligrams, were unable to kill an animal, but found at max they had temporary paralysis, which marijuana users would call being couch-locked. Negative symptoms can be minimized by a few strategies: meditation, hydration, counteracting with high CBD, eating pulpy citrus or drinking lemonade, cooking and smelling crushed black peppercorn, or drinking a cup of chamomile tea. The results will be variable for everyone. An initial positive result, never having benefit, experience side effects every time, or developing tolerance with repeat use. There are a lot of variables, so if after a month you have not met your goal, we would recommend you making an appointment for a consult visit to review your process. Our suggested strategy begins with placing your medicine in two categories: maintenance and breakthrough. Maintenance medications are long-lasting and of a chemical composition to treat or promote health. Think of it like a scheduled vitamin with the goal to bring your baseline symptoms down to tolerable and then have less severe or frequent flares. Breakthrough medications should be quick to start working and may have a stronger chemical makeup to focus on minimizing those acutely worsening symptoms of a flare-up. Examples of breakthrough situations include to stop a panic attack, a pain flare, seizure, or to go to sleep or stimulate appetite. Oral use is not a breakthrough option. Inhalation methods include herbal or oil vaporizers and nasal sprays. And one day in Florida, smoking will be allowed too, but this is less healthy than vaping and wastes more medicine. With these methods, the medications enters directly into the bloodstream, bypassing the liver's conversion to a more psychedelic THC. Given the effects will be felt within 5 minutes, it's great for breakthrough use, but patients who use this as their only method may find they use it up to 10 times a day and unfortunately living from crisis to crisis. Inhalation is one of the easiest ways to consistently dose, but there is a wide variety of vaporizers on the market and many require practice before achieving optimal use. Ask the dispensary how many seconds typically are needed to get 1 milligram, but then treat each pen as if it's your first and just take a short second in the first few uses. You can always do it again later. Make sure you know how to turn your vapor pen on and off to preserve battery life. To use the vaporizer, first fully exhale, then inhale the medication slowly to fill 1/3 of your lung volume. Then fill the rest of your lungs with an inhalation of fresh air to make sure the medicine is pushed down to the base of your lungs where air is exchanged with the blood. Pause for 2 seconds, remembering your body is very efficient, and release with a slow sigh. You may not see any smoke upon exhalation, and smoke is not a measure of a good hit, rather a sign that maybe medicine is lost, a vaporizer is set at too high of a temperature, or flavor or MCT is being burned off. Adjust your technique to more frequent hits with 5-minute gaps in between. Give favor to the dispensaries that use 100% cannabis vape pens. We don't suggest using oral solutions in your vape cartridge. They contain extra ingredients not meant to be smoked. Even additives of MCTs like coconut oil that some dispensaries use in their vape pens, when heated actually turns into acetaldehyde, which is an unnecessary toxin. Some people will experience burning sensation, cough, or headaches if their vapes include MCTs. While reserve concentrate oil doesn't contain MCTs, it's not ideal for use in vape pens because they've been preheated, and due to the thickness, you may miss some of those usual full spectrum of chemicals. Sublingual is a category that includes drops, often called tinctures, oral sprays, or lozenges. Since the time of onset is between 30 to 45 minutes and duration 6 to 8 hours, this may be the preferred option for patients who do not want to vape, as it can be used for both breakthrough and maintenance. It's actually the most economical way to take medications once you find a brand that works. Instructions for use, whether using drops, and we recommend a small syringe as pictured above over an eyedropper for more precise measurements, or sprays, is to hold the medicine under your tongue, then massage into your cheeks and swallow after holding it for several minutes. If drops are alcohol-based, you may need to mix with water first to wash away some of the alcohol that could irritate your gums or tongue. Brushing your teeth first can increase the blood flow in the mouth and speed the onset of action. Sometimes, dispensaries pass off oral concentrate orals as sublingual drops, and you will know this if the oils are very thick, have a poor taste, or the onset is delayed to match what would have been expected for oral ingestion. So be wary if you hear or feel otherwise. The oral category includes capsules, oils, and edibles. We do not suggest starting at these if you are a cannabis beginner, but if you do, be patient and restrain not to eat too many. This method is meant for maintenance use only, since its effects are delayed up to 2 hours and can last beyond 12 hours. We caution to use this method at the lowest milligram, given that THC can convert to a more intoxicating version of THC after going through the liver. Since capsules come in standardized doses, it's best to find soft shell caps that can be frozen and cut in half to split the dose. Take caution with cooked edibles, as cutting in half may result in inconsistent dosing if the pan was tilted or not spread evenly during production. Topicals include lotions and patches of variable onset and activity. Patches or transdermals often have molecules to help the cannabinoids to penetrate the skin and enter the bloodstream for a more full body effect. For lotions, CBD penetrates the skin better than THC, good for targeting localized areas where the skin is thin and has superficial blood vessels, including for conditions of arthritis, neuropathic pains, infections, rashes, or skin healing. Lotions from dispensaries may be expensive, so you can try homemade versions using mixed extract with a fatty base such as coconut oil, shea butter, or beeswax to help it penetrate past the skin. Suppositories exist for both vaginal and rectal use, and this may be preferred route if large doses are needed or intolerable to oral or inhalational methods. Also, the local absorption can directly be helpful for lower gastrointestinal and genital conditions. There is minimal intoxication and the effects can be quickly noticed and last about 8 hours with minimal psychoactivity since it passes the liver metabolism. Foria is an example of a commonly marketed product in other states. It's a vaginal suppository to treat pelvic disorders and sexual dysfunction as a vaginal suppository with a ratio of 1 to 6, 10 milligrams CBD and 60 milligrams of THC. Patients can actually make their own glycerin suppositories for molds provided at stores. Just make sure to ask the dispensary if the liquid extract is alcohol or oil-based. How much someone might need depends on the degree of natural cannabinoid deficiency, severity of illness, and dependency on pharmaceuticals, with a range from the first effective dose being around 3 milligrams. Even in small amounts, these chemicals can promote health, not just minimize disease, and are not addictive. Our recommendations sound cliché but true. Start low and go slow, and more is not better, less is more. This is based on learning the dosing strategies of cannabis specialists and reading study protocol with the goal of using cannabis to support your natural endocannabinoid system rather than using it like a traditional medicine to replace it. At low doses, the THC, the cannabinoid receptors become more sensitized, but at higher doses, the THC actually turns off receptors. More highly researched conditions like the automatic qualifying conditions may have suggested dosing protocol based on the scientific studies, and we will share that with you if applicable. But when treating symptoms, it is a personalized to whichever provides relief, a strategy of trial and error, which is called titration. It's easiest to find the optimal use using sublingual drops for consistent measurements. Based on Dr. Sulak's protocol, start with 1 milligram of THC and or CBD and increase by increments of 1 milligram per dose. Pay attention to the subtle changes, such as internal relaxation, pain relief, ease of breaths, fatigue, or other unwanted effects. If you take a dose and do not find any effects, after 1 hour you may take another dose of sublingual drop. After a 4-day interval, restart this process from the beginning dose and increase each again by 1 milligram. By going this slow, you will find that by priming your receptors not to expect too much in the beginning, and then on retrial, you will suddenly have good effect. The method that's explained is called microdosing, and an online search of microdosing marijuana will reveal the popularity of this scientific trend of using the least amount of milligrams necessary for the greatest benefit and safety. When you have a natural endocannabinoid deficiency, because our bodies have been stressed by disease, our inflammatory diets, and mentally fatigued, the cannabinoid receptors not being used are turned off, and then when supplementing with low doses of cannabis, because of this positive reinforcement, the receptors are reactivated over a period of about 4 days. Go slow. It's said because of this potential delay in noticeable effects. With age, metabolism slows, and even lower doses may be suitable. Doing the math using the dispensary's labeling may be confusing for how much equals a milligram. You can't go wrong using the same strategy of increasing by a drop a day if that's easier. 10 drops equal about half a milliliter or half of a dropper full. Oftentimes, when someone finds the sensation of feeling good, they desire to make it last or make it great by taking more. Sadly, this leads to the development of tolerance, where higher doses result in diminishing effects or possibly side effects. This is why we recommend a diary for you to monitor your daily consumption and maintain sensitivity by taking 2 days off now and then, restarting at 50% less. In fact, it takes about 6 days of real abstinence for your receptors to completely unbind, so even the long-time heavy users could restart like a non-user. Look at this graph starting from the bottom left, where there are people not using cannabis. As they start the titration up, when they find the optimal dose, they continue to take more, and the slope turns downward for less attainable relief. Other users or dispensaries will suggest that due to tolerance, more milligrams are needed, and certainly with increasing doses, relief is found once more. But this is less natural and a more pharmacological use of cannabis. The first peak is with microdosing. You are giving your natural cannabinoid system positive reinforcement to rebuild and regulate itself. Now, some people are too sick that their natural systems just won't come back online. The second peak, a much higher dose, overwhelms the receptors, which are now no longer needed because they are taking medicine to do the job. What we care about is that you are one of the happy faces, and the quality of life is back in your grasp. But I explained this graph for the science that is revealing you may not need as much for the same or even better result with less risk or side effects, and it will certainly save you money. At Southern Comfort, we can appreciate that due to this trial and error nature of the treatment plan, you may use more milligrams in the first few months while testing out products. You should not have any issues with running out, as we overestimate your needs in the state registry to avoid you having a refill too soon scenario at the dispensary. But do not misunderstand that this amount is a starting point nor a goal. Following the previous microdosing advice would be better. If you are exceeding the total amount of milligrams we placed, then we will require you to have a visit to discuss dosing strategy, where an increase of milligrams will be considered at that time, not guaranteed. If you are using oral methods, including reserve concentrate oil sold at dispensaries, just start lower in dosing and go slower, because this modality has a greater risk of unwanted effects. It may be not right for the cannabis beginner, but when you are ready to experiment with it, start with a THC dose of less than 2.5 milligrams. Maybe up to 15 milligrams of THC for persistent problems or the restless sleeper once or twice daily. Above that dose would be for those with really developed tolerance or seasoned users. As previously referenced, Dr. Sulak is an admirable cannabis physician with vast clinical experience, having helped near 20,000 cannabis patients. So we highly recommend reviewing his website, healer.com. Here you can find recorded video programs and worksheets that you can use during your experiment. And he also cites scientific studies that use similar protocol to show that it's been validated. These include programs such as the sensitization program, which is also recommended for current users, and it's similar to a 6-day detox designed to minimize withdrawal and help decrease cannabis use by 60% and yet achieve desired benefits. The Introduction to Cannabis 4-day program will handhold you through those first days with videos and worksheets to help find your optimal dosing. Another program to highlight is the inhalation to tincture switch, which is helpful for those who start with only using vape or smoking and desire a longer-acting method to complement a more consistent body chemistry for overall financial savings as well. Dr. Sulak has suggestions for minimizing the psychoactive side effects, shopping hints, and dietary recommendations. This is important for your treatment plan too. Adjust your lifestyle and eat less inflammatory foods while eating more of the building block nutrients to redevelop your natural endocannabinoid system. Foods such as walnuts, eggs, flaxseed, omegas, and dark chocolates. If your goal is to come off any medications, do so under the prescriber's supervision. But we would suggest initiating with cannabis first and then weaning off after 2 weeks by cutting back 50% of your prescriptions at least. Afterwards, you may have less rate of decrease, but that's okay because any decrease in opioids or benzodiazepine use is actually a success. An 8-page PDF protocol specific for reducing or replacing opioid use based on his research, Dr. Sulak's success in his clinic, can be found online and gives specific strategies and statistics, such as that regardless the amount of opioid decrease, 87% of his surveyed 500 plus patients found a significant improvement in the quality of life. The most important and probably most challenging part of this self-guided experiment is the selection of product characteristics. This is where dispensaries really differ in treatment theory, business model, and where patients potentially could be misguided, resulting in jaded results. Please listen to the recommendations in this video and the written materials, as these are more detailed compared to what the state or dispensary has on file for your orders. We purposefully keep the instructions basic in the registry to avoid you from being pigeonholed into only buying from one dispensary. When we go over a few strategies for approaching the dispensary's menu of products, anyone can really use these pearls for product selection. Number 1, to use more CBD in the day to keep more mental clarity, and increase THC at night if needed, because honestly there's less need to be socially appropriate when you're sleeping. You just have to be very relaxed. Number 2, THC is psychotropic. It can get you high. And even though that term has a negative connotation, sometimes it's just a sense of the weight of the world coming off your shoulders and allows you to concentrate. But constant high THC can also tend to induce anxieties. You are unlikely to get high at ratios of 4:1 CBD to THC. At 1:1, this is a gray zone, and you need to use caution, which is the same advice I would give for other prescriptions. If you are truly ill or in a flare, then higher dose of THC will be less likely to get you high anyways. It's like someone who has a panic attack taking Xanax to get grounded versus someone who uses Xanax when they're normal and then becoming sedated or high. It's about using THC in the right ratio and scenario. Number 3 is to titrate starting with a higher base of CBD and then add THC in increasing stepwise amounts to your daytime maintenance doses with a goal of lowering your baseline symptoms. Number 4, for breakthrough symptoms, possibly flares of pain, anxiety attack, pre-meal appetite stimulation, or tremors, you can consider a rapid-acting method of higher THC or CBD, whichever tends to work better for you. While most associate THC with nerve pain, for some people, for example, those with spinal stenosis, actually need more CBD after heavy exertion to stop the swelling within the spinal canal or joints that can compress and aggravate the adjacent nerves. Some people need higher CBD for sleep because of the chemical deficiency in acetylcholine, while others, their insomnias are due to the severe pain and may need more THC. We hope that you achieve maximum benefit from whichever or blend of the two strategies we go over. In the first, we focus on the science, knowing about the cannabinoid receptors and lab testing. So in the maintenance column, try to focus to maximize your CBD, as it can be used to balance chemicals in the brain that destabilize moods or cause symptoms of anxious stomach. CBD relieves nerve pain by acting as a natural gabapentin to calm overactive nerves, and NSAID medications to decrease swelling, which decompresses aggravated nerves. This is because CBD receptors exist in all inflammatory and immune cells, meaning that it can be helpful for autoimmune conditions and cancers too. And importantly, it is pretty much like an antidote to the high that THC can give. So even if you don't think it works, then having a bottle of higher CBD on hand is good for the event that you overindulge in THC. THC is needed for the entourage effect to make CBD more effective at lower doses. So for financial reasons alone, that's beneficial and explains why some people have failed hemp CBD experiments. THC is also very medicinal, as its ability to allow tolerance to triggers of anxiety and pain. It can relieve tremors and spasticity, reduce and halt dementias, and act as a nerve protectant to irritants that cause neuropathies. Using too much THC can actually cause chronic nausea, known as cyclic vomiting syndrome, but acute excess can also lead to dizziness, discoordination, and paranoia. Insomnia is another condition, similar to anxiety and pain, that needs to have either CBD in the case of a chemical imbalance or THC if it's pain or bad dream that awakens. So for breakthrough symptoms, you can consider either CBD or THC, or just increase the milligrams of a balanced ratio. All options can be justified, and that's why it's all about your personal needs. Now for a brief lesson about ratios or proportions, and it's a math concept you may need to re-watch because you should understand this so you can be a smart shopper. It's written as two numbers with a semicolon separating them, and traditionally we use the first number for CBD and the second number as THC, but dispensaries may have them reversed, so read the labels carefully as some of our patients have unintentionally bought the opposite products and experienced significant side effects. I think it's easiest to visualize this as slices of a pie, and in the top left picture is a pie with 11 slices, and one small sliver of this is a THC slice of about 9% of the total pie. On the bottom right, 5 larger slices are THC, and this is 85% of the pie. Another tricky part is interpreting the labels and the meaning of the percentages reported. In this illustrated example, the percentages will add up to 100% because it's a true comparison of CBD to THC. If percentages advertised don't add up to 100%, then it's reasonable to ask what it's being compared to, and then recalculate for a comparison of CBD to THC. Use this label as an example. If we compare 0.2% CBD to 3.2% THC, this will actually be a ratio of 1 to 16, with certainly psychoactive potential. Dispensaries may not publicly advertise ratios if really they're one-sided, or if the growth of the marijuana is variable per lab testing each month. That would be pretty costly on their marketing budget to reprint continuously. They do have lab labels, however, which can be interpreted as above. This is just another popular chart that can be used as an example of how someone might tailor the ratios for specific conditions, knowing, however, this is not a set rule for any person. If ratio selection becomes too complicated, then you can easily just start with a 1-to-1 ratio with subtherapeutic microdosing and advance slowly. The bottom line is, in addition to understanding that CBD and THC work at different parts of the body independently, the final ratio is also determined by sensitivity to THC. When used appropriately in correct ratios, you will need less frequent dosing and in smaller amounts, experience less severe and frequent trigger events, and be able to medicate throughout the day and still function normally. In the previous video about science of cannabis, we went over the terminology snafu that is pop culture versus science. To summarize, we know that CBD and THC can cause certain mind-body effects, but other chemicals called terpenes also play a great deal into whether someone will be relaxed or energized, for example. Pop culture has oversimplified terpenes to put cannabis into two basic categories, sativa or indica, and if that's not clear, then it's just labeled a hybrid. Here are how many cannabis users would describe the characteristics. Sativas can be stimulating like a strong cup of coffee, best used in the daytime for energy and brain awakening effects to enhance creativity and uplift a depressed mood for socialization. They are also good for symptoms of appetite or nausea, inflammatory pain, and migraines. Some people, however, will experience increased anxiety or paranoia if overstimulated, while others with attention disorders would state that it provides focus. Sativas tend to have a lighter, fruitier aroma. Indicas are more body relaxing and can calm anxieties, help sleep, target neuropathic pains, and be a more potent appetite stimulant. A possible side effect would be feeling too tired or couch-locked or fuzzy. So when targeting sleep, you can either increase THC, or if this is unpleasant, then you can choose a specific indica blend. There are about 400 terpenes, and each has unique properties that may be specific to your symptom or disease state. For example, lemon haze, trainwreck, and sour diesel are all strains containing the terpene limonene, which can help with acid reflux and elevate mood. Blue Dream has pinene, which also opens airways and decreases inflammation. Skywalker has a terpene linalool, which helps with nerve stability for seizures and calming nature. Chemdog and Girl Scout cookies have beta-carotene, useful for muscle spasms and insomnia. And ironically, Girl Scout cookies and Harlequin are strains with the terpene humulene, which like CBD, can suppress appetite and help with weight loss. Granddaddy Purple and Blue Dream's myrcene can enhance THC psychoactivity, but also decreases inflammation and infection. It's agreed that when using these names as professionals, it may cause some question of the seriousness of this medical industry, but we want to ensure you that your experiment is optimized and that this is why it is partially preference-based. These terpenes are what gives the flower its aroma, so if it's unpleasant, it wouldn't be helpful, but it can be used to your advantage. Leafly.com is like a Wikipedia for marijuana education that you can use to complement your search for a personalized strain. Finally, it's difficult to answer how much will marijuana cost for a number of reasons, one being the supply and demand in the presence of a tightly government-regulated industry, and very much so also depends on the method of use, characteristics of the product and dispensary, and how much you need daily. It ranges between $50 to $200 a month on the higher end, especially in the beginning. On your first purchase with a medical cannabis supplier, try to spend less than $100, which is possible with the discounts that they offer. Many patients are convinced to buy more than what they need, but better to buy a variety of samples than any one in excess. Costs can be minimized with the discussed strategies of blended ratios, microdosing, and sublingual drops. Until federal regulations change, insurance won't consider covering it. We hope that you find the cost would be worth the better quality of life and maybe need to spend less on pharmaceuticals or additional office visits in the long term. Thank you for watching the educational series, which allows us to spend more time taking your education to the next level when we are in our office visits. Our contact information is the phone number 772-218-7262 and email at support@socommjclinic.com. When leaving a message, please include the details of your question, your phone number, and email address since we often respond after hours. But please allow up to 48 hours for response. Thank you for allowing us to be part of your healthcare team.